Okay, you ready to have some fun? Rich man, poor man walked into a bar. Both of them order a beer. Poor man pays $5 for the beer. What's the rich man pay? $5. Rich man, poor man buy a dozen eggs. Poor man pays $3 for a dozen of eggs. What's the rich man pay? $3. Rich man, poor man buy car insurance for their 2000 Ford F-150 pickup truck. Poor man pays $100 a month. Rich man with the same risk factors pays what? $100 a month. Rich man, poor man turn 65. Sign up for Medicare Part B insurance. Poor man pays $185 a month. What's a rich man pay? Well, up until 2007, answer would have been the same, $185 a month. What is it today? $628 a month. Why? Because under President George W. Bush, a Republican, in 2007, the Republicans decided the way to solve our debt crisis was with means testing. How's that working out for us? Means testing. Republicans, you gotta think of a better way, because this ain't working. I have to admit that I had completely forgotten that it was the Medicare Modernization Act of 2003, the one that created the prescription drug program, that also started means testing Medicare in 2007. When the program first started, it wasn't quite as steep as it is today. That is the means testing part of the program. In 2007, the lowest premium was $93.50 and the highest was $161.40. The lowest premium has gone up 98%, or 8% a year since then. That's still quite a bit. The highest has gone up 321%, 16% a year since 2007. The means testing part of that bill in 2003 got very little attention. Most of the attention went to the prescription drug program. And I'm sure when it first started out, the means testing looked affordable to most people. Now, not so much. When you get up around $628 a month, just for outpatient services, it gets to the point where some people might decide, if it gets much more expensive, that it really is much better simply to self-insure for that part of your health insurance. Tomorrow, I want to share with you a couple of quotes that preceded passage of the 2003 Medicare Modernization Act. Before passage of the 2003 Medicare Modernization Act by an all-Republican Congress in 2003, House Budget Chairman Paul Ryan argued, means testing is an obvious solution to our fiscal problems. The alternative is everybody gets cut. So why don't we put the money where it should go, to the people who need it? Over in the Senate, the self-described Democratic Socialist Bernie Sanders was arguing against means testing, saying, the strength of Social Security and Medicare is that everybody is in. Once you start breaking that universality and you say that if you're above a certain income, 2 years later that income goes down, and 10 years later it becomes a welfare program. As you may or may not know, Medicare Part B and D premiums are heavily subsidized by taxpayers. Part A, the hospitalization, is the part you paid for with payroll taxes while you're working. Part B is financed by premiums and taxpayer subsidies. I wanted to know what we would all pay if we all paid the same and none of it were subsidized. The answer, $343. ChatGPT, which found that answer for me, asked me, would you like me to draw a chart comparing what the rates actually are to what they would be if they were all the same? There are 6 income brackets to determine your premium. 2 of them are heavily subsidized. 1 of them pays the actual premium, and 3 pay more than the actual cost of Medicare. 93 to 95% of all enrollees are in one of these first 2 heavily subsidized brackets. Only 5 to 8% of enrollees pay any surcharge whatsoever. The top 3 tiers comprise only 3% of enrollees, and the top 2 tiers only 0.5%. 93 to 95% of Medicare Part B enrollees are paying a heavily subsidized premium, well below the full cost of $343 a month. The difference is made up by general tax revenue, mostly by the progressive income tax, federal borrowing, and the overpayments made by the top 5 to 7% of high-income enrollees via those IRRMA charges. The total taxpayer and deficit-funded subsidy for Part B in 2024 was $130 billion. 8 to 11 billion of that came from the enrollees in those top 3 brackets. So while these people are paying way more than the actual cost of Medicare Part B, it's barely covering any of the subsidy. One final note, Medicare Advantage has turned out to be the single most defrauded program in the history of the United States, up to $500 billion so far. So when Paul Ryan said means testing is an obvious solution to our fiscal problems, not only has he been proven wrong, we should probably call the 2003 Medicare Modernization Act Ryan's Folly. The reason I spent so much time this week on the decision to means test Medicare in 2003 as Paul Ryan's obvious solution to our fiscal problems is because Republicans are now once again talking about means testing as the solution to our now very scary national debt. I hope I've proven beyond any doubt that means testing Medicare Part B, which has about 3 to 5% of the enrollees paying far more than the actual cost of the insurance in order to cover about 10% of the subsidy for these 95% of the enrollees, has been an abject failure as a solution to our fiscal problems. The decision to means test Social Security, the tallest of our 5 spending towers, by taxing 50 to 85% of the benefits of the higher income enrollees, has also failed. The trust fund will be insolvent before the next president leaves office. In the wake of those 2 decisions, our national debt has gone from troublesome to yikes, and doing more of the same is only going to delay the necessary solution to the insolvency of Medicare, Social Security, and our nation. After one of our recent videos, one of you, Jerry Stevens, remarked that he was surprised to learn that the unsubsidized premium for Part B Medicare insurance would be as low as $370 a month. That's what we would all pay if the premium weren't subsidized at all, and none of us overpay. Of course, some of us overpay quite a bit. Some of us underpay quite a bit. Some pay the exact amount. Jerry, would you be even more surprised to learn that if none of us overpaid, that if we kept means testing Medicare, but we capped it at the actual cost of the insurance, $370, and we spread this overpayment by 500,000 people around to the whole group, how much more would all the rest of us have to pay for our Medicare Part B premium? Look over my shoulder. $2.74. That's right. That's all. We are overcharging these people a lot and only saving $2.74 a month. Who knew there was so much wealth envy in Congress among Republicans? Because remember, it was an all-Republican Congress and president who passed the 2003 Medicare Modernization Act under the guise that means testing is an obvious solution to our fiscal problems. I don't blame you if you doubt that number. I had trouble myself wrapping my head around the fact that an all-Republican government in 2003, led by George W. Bush, Tom DeLay, and Bill Frist, would means test Medicare Part B premiums to the extent that about 500,000 people would pay roughly $80 million a month more than the actual cost of the insurance in order to save the other 28.5 million people $2.74 a month. But the math doesn't lie, and here's the math. It takes 5 steps. Step 1 is to identify the IRRMA brackets, something a local congressional aide couldn't do until one of his constituents educated him on this. No, it wasn't me. People earning up to $106,000 pay $185 a month. That is almost everybody, 27.9 million people. The next group up to $133,000, these are single individuals, pay $259 a month. That's 1.2 million people. 0.6 million pay $370 a month. That is the exact cost of the insurance. And then you get into those who pay more than the actual cost of the insurance. 300,000 pay $480.91, 150,000 pay $591.80, and 50,000 pay $628. Step 2 and 3, calculate the overpayments, the premium minus $370, and then the number of people in each group. 300,000 plus 150 plus 50 is 500 enrollees. You add up all of the enrollees and all of their overpayments. You do that math, you come up with a total of $79,500,000. If you redistribute that overpayment to all of the enrollees, You divide that 79.5 by 29 million enrollees, and you come up with $2.74 per enrollee per month. Now, if we really wanted to be helpful, what we would do is we would eliminate not only that overpayment, but about half of the federal subsidy, saving the government about $60 billion a year. What would we all pay then for our Medicare Part B insurance? $258 a month. Does that sound fair? It does to me. Would someone please tell U.S. Senator Marsha Blackburn to stop boasting on Fox News that she gave everyone on Social Security a new $6,000 tax deduction? She may have forgotten that she means tested that too, to deny the deduction to the people who pay the most taxes. That's not me. I get the deduction, as do about 97% of all taxpayers, which I didn't ask for, and I don't want us to have, because it makes this deficit problem and this debt problem even worse than it is today. Not only is she bragging about making our debt worse with more pandering to seniors, she's not telling the truth, or she doesn't know the truth, which is possible. So will someone who knows Marsha please tell her the real truth? You don't have boomer power unless you're willing to hear and tell the truth, and only boomer power can prevent a debt fire.